Good afternoon, and thank you for joining us here on TV Bakwetu. My name is Elias Munshya, and I am coming to you live from Calgary, Alberta, from Bakwetu Studios. Also, from Munshya Law. I use the same offices for media as a media studio and also as a law firm. So it's chambers and studio. Who knew that you could combine these two? Today's topics are excellent. And so we're going to let you have a little bit of time to share the word around. Spread the word around because we have Dr. Aaron Mujajati. The reason why we must talk about these issues is because imwe mulatuseka atimweba ume tamulanda po. So today, twalalanda po. Lero twalalanda po, twalafika po. And the reason is because it's a health issue, it involves men, and we just have to deal with some of these things. So that's why on TV Bakwetu today, we have Dr. Aaron Mujajati. So spread the word around, and then once we see that we have reached our numbers, we are going to bring our guest in. For now, I don't host this program alone. The reason is simple. It is because I am boring when I'm talking by myself. That's why I do have a co-presenter with me, and his name is Mr. Norman Chipakupaku. Mr. Chipakupaku, good evening and welcome to TV Bakwetu.
Good evening, Chiwempala. I think it's our tradition. Chiwempala must be addressed first. Good evening, Zambia, and good evening to all our viewers wherever you are. What a day, what a fantastic day. How is Canada today, Munshya?
It's quite hot. I can see that my temperature read is 30 degrees Celsius, 30 degrees.
Fantastic. It's a sign that summer is here. You can see I'm casually dressed today, which is very, very good. And right. Because people are saying I'm boring when I'm in a tie. So today I'm casual.
Okay, so you're connecting that in the days that you wear a tie, our listeners, our followers, they say that you are actually boring in a tie. Is that correct?
Yeah, that's what they say, that I'm too boring when I'm wearing a tie. So today I'm trying to be casual. And Munshya, it's a very good day because so many things are happening at home. Are you aware that ECZ has banned the banning the rallies? No rallies in Zambia.
Right. Yeah.
And what was surprising is that ECZ and Minister of Health, Minister of Information, DMMU, all combining to say there are going to be no rallies.
Right.
And it's very interesting because it's also linked to a plan which we hear that they want to actually cancel the elections.
Okay. Now, I think those topics, General, we are going to bring them back. Today, we want to deal with men's health. And our guest, we don't want to make our guest feel like we are trying to kidnap him into topics that he did not.
No, Munshya, this was just to get our viewers up to speed. Some of them have been very busy. They don't know what's happening at home. I think we are the right source for news from Zambia. Whether political, whether economic, whether social, whether health. I think tonight is a healthy issue. Let's focus on that.
All right. Now, the issues of health and so health is general. There is health for men, health for women, health for children. Why should we today talk about health for men?
I think there are certain things, certain issues which affect men.
Right.
And especially at home, even in where we are, in the UK, a lot of men, especially the African men, we have this culture that we should not talk about our health issues.
Right.
We have this issue that people should not know about my health. We don't discuss. There are certain things which are a taboo, which we should not discuss. I know that I can't discuss about certain issues because my daughters might be listening. So I have to be very, very careful. So
Right.
I think it's time that we tackle some of these issues. And I think
Right.
prostate cancer is one issue which I feel must be discussed, because I've lost a number of friends in Zambia from who have died because of prostate cancer.
Right. Yeah, I have several close people in my family that are struggling with prostate issues, but before it even becomes a cancer. But that's the whole reason why we have Dr. Aaron Mujajati joining us right now. And I am going to introduce him because we're already at 600. And so we can't wait any longer. Dr. Mujajati Aaron, good evening. You are muted, Doc.
Oh, okay. I should be unmuted by now.
All right. Yes, we can hear you now.
You can hear me, right?
Well, Doctor. Very well, Dr. Jati. And how's Lusaka?
Good to see you.
Thank you.
Yeah. Now, Doctor, I need to be very clear right from the start that I have water with me here.
Oh, what time is it right now in Canada for you?
It's 13:09.
Then we are not worried. You can drink the water.
Okay.
We don't expect accidents.
In Scotland, it's 20:09. In Scotland,
well, you may want to drink a very small volume.
my drink is this one. It's a very nice drink. It's called Sunquick, Doctor. I hope it's healthy enough.
No, there's water in there as well.
Oh,
I hope it's not just food coloring, sugar, and water.
Yeah, well, that's my drink. I'm accused at times. They always suspect that I add something. No, I don't. It's not just Sunquick with water.
Right.
All right.
That's good.
So now we need to set a few things. We need to clarify a few things, Doc.
Yes.
What was the issue about your eyebrows today? Because you are all over. You are trending because of eyebrows. Please tell us, clarify. What was that about?
To be honest, I also don't know. Someone just complimented my eyebrows, and I was very surprised. It made me laugh quite a bit, and I thought I'd share the joke as well. Yeah, I think that's where it came from. Yeah.
All right. Because when you are a celebrity, because you are the only legitimate celebrity we have, and when you have a celebrity, I don't know. So when you are a celebrity, people pay attention. People pay attention.
No, I was surprised. It's the first time someone has actually, commented on something of that nature. So I was very, very surprised. Yeah.
All right. Okay. Yeah. Now another thing is, we know you. We have interacted with you over the years. You have used social media very well.
Oh, thank you.
And you have been very consistent. And I think that's one of the things, right? Consistency in social media and in speaking to the people. But there could be one or two people who still do not know you. So we want to give you an opportunity to tell us, who is Dr. Aaron Mujajati?
Right. So I was born and raised in Lusaka to a Lozi woman and a Shona man from Zimbabwe. Right. And I've lived all my life in Zambia and Lusaka, so I'm a Zambian citizen. I am married to a fellow doctor. She's a cardiac anesthesiologist. Her name is Dr. Ushma Ben Patel. And between the two of us, we have four kids, all girls, by the way.
All right.
And I went to school in Zambia. I did my primary school at Emersdale Primary School from grade 1 to 7. And then I did grade 8 to 9 at Matero Boys, grade 10 to 12 at Hillcrest Secondary School. Then I was in first year at the University of Zambia in 1997, where I obtained my first degree in human biology. So I have a bachelor's degree in human biology, after which I obtained my second degree, one in surgery, the other one in medicine. So I have an MB-CHB. Then I went on to obtain my master's degree in internal medicine. So I'm a specialist physician. Then I went on to do an MBA in business. I went on to do an MBA in healthcare management. So I also have a business inclination. I went to law school, by the way. After the first semester of law school, I ran away. The exam was a bit, intimidating. I keep getting pressured to go back to law school.
Go back, please. Go back.
But I don't. Law school it was a lot tougher than I thought. Was a lot tougher.
Now we are getting interested. So where is Jerome? We need to bring Jerome here because Jerome is our resident pharmacist.
Right.
And what Jerome said has gone viral. Basically, he said that.
Oh, is that so?
Yes, what Jerome said was, of course, there is this political thing with your colleagues going on strike and everything else. And one person suggesting that the striking doctors should be fired. So Jerome Kanika, who is a pharmacist, he came back and he rebutted what that gentleman was saying by telling him that Iwe ulichikwa kwa. We who did natural sciences, you should be in the affairs of us people who did natural sciences at the university. And so, but so I'm quite tickled by the fact that when you went to law school, it was much more difficult than you had expected. So you were expecting that it's a course for Ifikwa Kwate?
No, not really. I was just shocked at how tough it was. Maybe it's because I'm so scientifically oriented. To change my thinking into, another way of thinking. And as you are aware, I mean, law has a language of its own. Medicine has a language of its own. So to learn the language was a bit of a challenge for me. So I ran away from law school. It's something that keeps bugging me. I hope one day I'll go back.
I can't blame
away
you.
From that. So away from that, I have worked in the government as a doctor, and I rose through the ranks anyway in the government up to the level of consultant physician. I've also been a lecturer in the University of Zambia, part-time lecturer. I've been teaching internal medicine. I've also been teaching medical ethics, and then I went on to serve as CEO of the Health Professions Council, and that was my last assignment in government. Since then, I have since left. I'm now doing my own things. I'm in the private sector. I operate a clinic called CarePick Specialist Clinic that we operate up to now. But also at the same time, I've run other businesses. I mean, one of my companies is in insurance. The other one is in transport. I've also done a few things in commodity trading as well. So, yeah.
Doctor.
And then in my pastime, I do these things I do on social media for, to give back to the community, as it were. Yeah.
Doctor, you did a very good thing to do an MBA. Forget about law. You took a very good course. Forget about being a lawyer.
There's not something wrong with lawyers.
What I'm saying is that if taking an MBA is giving you a better deal to run all these businesses and to help you diversify, this guy, the lawyer, won't give you that knowledge. So stick with your business side and with medicine. That's a fantastic combination. You can hire Munshya as your lawyer. Don't worry about that.
No. Okay, yes, of course he can hire me, and I think in his life he has hired several lawyers, obviously, because even medicine requires lawyers. Everything.
No, it does. Unfortunately. No.
You have to be unfortunate. This interview is not going as planned. Okay. Now, Doctor, you also had a stint with the Resident Doctors Association. Were you president? What was your role there? Was it Zambia Medical Association?
Yes. So I was. I think I served 3 previous RDAZ presidents at committee level. I think I got introduced into doctors' politics in general quite early. From the time I joined the profession, I was thrown deep into doctors' politics. So I was into resident doctors' politics for some time. And then I decided to go for the big one. So I stood for president of the Zambia Medical Association. I served 2 full terms. I had a very interesting experience there. Yeah. So I'm quite familiar with that, with doctors' politics in Zambia. So my silence is deliberate.
All right. Okay. That's and you are calling them politics. There is definitely politics there.
No, it is politics. There's quite a bit of politics involved in that.
All right.
So is it politics with a capital P or politics with a small p?
Well, politics is a way of life. You have church politics, you have academic politics, you also have doctors' politics. Yeah, so could be politics with a small p if you like.
Okay, fantastic. Munshya, I think we've heard how experienced our doctor is. And for me, we always like to use local languages. So I would say, thank you so much for the introduction. And
how am I Tumela?
And so probably I should say Tatenda. If it's Tatenda from Zimbabwe, which is good. Now,
Tatenda
Zukuru. Zukuru, okay, Tatenda Rakanaka. Now let's talk about these serious issues.
Yes, sir.
And for me, I've lost friends. I've lost friends because of prostate issues. Yes. And I think I am an old man. It worries me every day. When I say old, I mean old. I'm old. And it worries me every day. When I wake up, I always want to ask myself, am I okay? So I want to hear more about that. So I'll do more listening. And I think I want the young man who has to go for this test to lead this discussion. Me, I want to listen. So Munshya, over to you.
Thank you. Doctor, there is a lot of confusion about what a prostate is, what is prostate cancer, what is prostate enlargement. And so we get lost in trying to differentiate all these things. And part of the reason is, I think we as men have very little time with our bodies, right? Like as a man, as long as or samba, you're okay. Very different from our female counterparts, because our women, they talk about it more. Culture talks about it more. Alangis talk about it more. Even doctors talk about it more, and there is a lot of activity frequently for females. For men, very different. So we don't know where the prostate is. Doctor, where is the prostate?
I agree with you that only dogs and women, only dogs, children, and women are given unconditional love, not men. Now, with regards to where is the prostate seated, only men have a prostate. Men are the only species of humans who have a prostate. So now the prostate is a gland. It's a very, very small gland, by the way, in its natural state. It's very small. So this gland sits just at the neck of your bladder, around the urinary bladder. If you have an idea where your bladder is, the sac that
Doctor, bladder nimulia umuisurire misute.
Correct. So the sac that holds urine before you urinate, the sac that even feels painful if urine is retained. If you are trying to pass urine, that pressure that you feel is because the sac.
Is it punching up pamulo? Because bladder yatampira palufumo.
Yes, it's really at the bottom, at the very bottom, at the neck. So at the bottom of the bladder, there's a tube that carries urine outside. Now that tube passes right through the prostate gland itself. So now you may ask me, what's the function of the prostate gland?
Yes.
The prostate gland is not a very useless gland. It's very useful, actually. So the fluid that carries semen. When sperm comes out or semen comes out,
Right.
There's that fluid in which the sperm swim. A huge chunk of that fluid comes from the prostate itself. But the prostate is not involved in the production of sperm.
Okay.
Yeah. It just involved in the production of the fluid that nourishes the sperm and carrying it outside. Okay. So now that gland, when you reach the age of 40, 45 and above, it begins to grow in size.
Don't say that. Did you say 40?
Yes, sir.
Musha, I told you, Musha, I told you 40. So I was right, Musha. Go ahead, doctor.
Thank you.
Okay. So when a man reaches about 40,
yes.
Because
so when you get
to the age of
40
already, Dr. Mujajati, because in I'm not.
Oh, you're not yet 40. Oh, okay. Right. I'm actually 46 this year.
Good point.
I'm 42. Okay, so I'm 42, doctor. Now,
right. You and me are now in that age group where our prostate is now growing in size.
Exactly.
And we can't stop it.
Yep.
So your prostate has just started a new journey. Okay. Mine has been on it for a bit longer than yours.
Okay.
Yeah. So the journey that your prostate has begun is where it now starts to grow in size, and you can't stop it. There's nothing you can do about it, and it will keep growing in size. Now that's what you call prosthetic enlargement. There's no cancer; it just grows. Now, prosthetic enlargement happens to everyone. So all men, after the age of 40, your prostate begins to grow in size. It's expected.
Okay.
Now, as the prostate is growing in size, you will find that when you cross the age of 55, 60 thereabout, you begin to experience certain symptoms. Because remember I told you, the tube that carries urine passes through the prostate itself. It actually pierces the prostate.
Yeah.
So as the prostate is growing in size, when you reach ages 55 to 60, you begin to notice certain things. One of the things you begin to notice is that if you're very observant, you will start going to the toilet too frequently to pass urine.
Yeah.
Like you're diabetic, and yet you're not.
Right.
So
I think
yes.
General, you are nodding too much. You say that you'll be listening. Please stop nodding. You are nodding.
Musha, I deliberately said what I said, that I'm going to listen, because what the doctor is saying, I've passed through those phases, and so I'm a good specimen, doctor. I think that's the right word. Okay. I'm nodding because I am over 55, I am over 60, and I've experienced, Musha, I always tell you, I have got a lot of experience. So wait until you reach 55. So go ahead, doctor. Go ahead.
Mulampesha, General Mulampesha. Go ahead, doctor, please.
So what starts happening now is that after you start experiencing passing urine too frequently, because that becomes like one of the first symptoms you start to feel, then the next thing you begin to feel is, because remember, as the prostate is growing, it's narrowing the tube inside. Okay. So the tube that carries urine begins to narrow. As that happens, one of the things you start noticing is that there's hesitancy when you want to pass urine. So when you go and pass urine, there's a pause before the urine flows, and then you have to push a little bit. As you go further, one of the things you start noticing is incomplete emptying of the bladder. You go and pass urine, you feel like you're done. You walk out of the bathroom, you have to walk back again because the bladder is not fully empty. That's as you go in age. And as you advance in age, say you're now around 70, 75, one of the things you begin to notice is that the strength of the stream of the urine becomes like the urine starts coming towards your shoes. So you can't push urine further like you used to when you were younger. So it's because the prostate continues to grow and continues to squeeze on that.
Those things we were doing as young people, children playing and then competing to see.
Competing, yes. That same competition you were doing. As you approach ages 75 and above, you can't compete in that game. They'll beat you hands down. Yeah, okay. I mean, the stream of the kids will be a lot further than yours. Yeah.
So you used to play that aiming game.
Yes, we used to.
Oh yeah, okay. Now I know.
So,
okay.
So that aiming game, as you grow older, 75 and above, you have to go and stand closer to the target, and then the younger ones have to stand a bit further from the target. Yeah.
Okay. Right.
Yeah. So because the tube inside is getting squeezed and squeezed and squeezed, eventually you begin to see blood in urine, not because you have a cancer. It's because the bladder, the stretching of the bladder, overstretching of the bladder, you begin to get blood, not because there's actually a cancer. But then when we begin to see blood, we also don't ignore it. We have to actually check whether there's cancer or not.
Right.
And if it's not handled, eventually that tube actually gets blocked. You actually begin to have what we call urinary retention, where you can no longer pass urine at all. Now, here's what happens. When the blockage is gradual, the bladder distends, okay, it becomes very big, and it's not painful. But again, you'll discover that you haven't passed urine in 3 days or 4 days. Then you come to the hospital. Right. But if the blockage is sudden, the bladder becomes very painful. So that's the distinction. So you come to the hospital with urinary retention, which is very, very painful. So people who have what we call BPH, which is just enlargement of the prostate, those are the problems they get, and they arise as you grow older in age. So there's a way of managing it. There are some drugs that we give to relieve the blockage. Sometimes if it's really, really unbearable, we just go in and remove the prostate.
Before you proceed,
for some
doctor,
people, depending on age, yeah, go on.
Before you proceed, doctor, what causes the blockage? Is it the old age? Yeah, go ahead.
So what causes the blockage is actually the enlargement of the prostate itself. Because remember, as it is growing in size outward, it's also growing in size inward and blocking the tube.
Okay, go ahead, sir.
Yeah.
Go ahead.
Yeah. So the difference there is that with cancer is that prostatic enlargement, the expansion is sort of like equal on either side. You know, it's like it's well distributed. Yeah. So it grows and maintains its shape as it is growing bigger. Eventually, okay, it will lose the shape. It will lose the shape eventually. Yeah. So with prostatic enlargement, all we encourage people to do is to just be checking once in a while and observing their symptoms. If there are symptoms, your doctor will relieve the symptoms with the drugs. Now let's go to cancer. Now, as you have noticed, with prostatic enlargement, as you advance in age, that's when the symptoms become even more severe.
Right.
Now, with cancer, it's different because cancer, it grows a lot quicker than the prostatic enlargement.
Okay.
And the symptoms I was describing arise much, much faster in cancer than they do in prostatic enlargement. That's the difference. So with cancer, with prostate cancer, you get the same symptoms I was describing, except that they evolve a lot quicker. Okay. The difficulties in passing urine, the frequency, and all those things I was describing, they come up much, much quicker. So you find somebody who is around 60, and they're having symptoms of somebody who is about 70, then you know that, okay, this thing is moving a lot faster. So when those symptoms are evolving very fast, you know that you're dealing with cancer. Now, here's the other challenge also with prostate cancer itself is that it can catch you at any time after the age of 40.
Okay.
Of course, the frequency is a lot higher as you go in age, but we've also seen prostate cancer in younger people. I've seen a 20-year-old with prostate cancer. Okay, it's quite rare below the age of 40. It's very rare. But we've seen 20-year-olds with prostate cancer. We've seen 24-year-olds with prostate cancer.
Right.
Okay. Although literature says it is rare.
Okay.
Again, in our medical field, if it's not reported in a peer-reviewed journal, it remains rare.
Yeah.
Yeah. You can't claim things that are not peer-reviewed. You know what I mean?
Right.
So even if I have seen it with my own eyes, But because it's not reported in the journals and things, it remains rare. But it doesn't mean it doesn't happen even in young people. So a 24-year-old who is having the symptoms I'm telling you about, fully blown, it means without even a doubt that's cancer. Because you don't expect a 24-year-old to start having problems passing urine.
Yeah.
Now here's the issue. As prostate cancer advances, the difference with prostatic enlargement, prostate cancer tends to spread beyond the prostate.
Okay.
So the first place it will go after it has spread beyond the prostate is that, first of all, it will infiltrate that same tube. It may infiltrate the bladder itself, and then it will go to the bones. So you find that here's somebody who's complaining of a backache that doesn't go away. Okay. In addition to urinary symptoms, they would have a backache that doesn't go away. It tells you, it tells you the cancer has spread to the back, but then it spreads to the bones first. So it's the bones that suffer. Then beyond the bones, it will go to the lungs. And when it reaches the stage where it has now gone to the lungs, you need to start writing your will, because you probably have about 3 to 6 months to live.
Okay.
Now here's the issue.
Yep.
With prostate cancer, all these symptoms I've given you, by the time you're having those symptoms, it's a bit late. Here's why. In the early stages of prostate cancer, it has no symptoms. You can't tell.
Okay.
So stage 1 of prostate cancer has no symptoms. You won't be able to tell. That's why with men who are older, who are experiencing the symptoms of prostatic enlargement, those it's a must. They have to check for prostate cancer every often, because the symptoms are confused and they are mixed. So you can't distinguish prostate cancer from just benign prostatic enlargement without actually checking the blood, because the symptoms are very similar. So there you need to be very careful. But if you're a little bit younger, like the way you are, my brother Munshya, it's very possible for you to develop prostate cancer, but you wouldn't know. The reason you wouldn't know is because in its early stages, it has no symptoms.
All right.
0 symptoms. So stage 1 and 2 of prostate cancer, symptoms, they're not that much. You can't even tell. That's why now we talk about screening. The only way you can tell that you have developed prostate cancer is if you did a screening. And the screening we do a blood test. No one pushes a finger in your rectum, like most men are scared. No, Dr. Mujajati, if I come for screening, you're going to start pushing fingers in my rectum, what. No, we don't do that during screening. Let me clarify this. Screening, it is not necessary to push a finger in the rectum.
Okay.
It's not. Previously, yes, we used to, because it was the only way. But it wasn't a very good method, because where your finger is touching, what if that's not where the cancer is? What if it's on the other side? Okay. So up to now, we still do the rectal examination, but it is not necessary at the point of screening. So at the point of screening, we just do a blood test.
Now, Doc, can I feel the prostate? Or
your own prostate?
Yeah.
Your own prostate, you can't.
Okay.
Now, doctor, before you proceed, there is I don't know whether it's a rumor, whether it's true, how that prostate cancer is mainly very common amongst African men.
That's very true.
Here in Europe, a lot of our men, us Africans, tend to have how true is it?
That's very true. So 1 in every 4 black people will develop prostate cancer. Wherever you find black people, it doesn't matter where they are. Whether they are here in Africa, in Europe, or America, wherever you find a group of black people, you will find a lot of prostate cancer. Of course, Hispanics have a similar predilection as well. So are Asians, but Caucasians, it's very low. They do get prostate cancer as well, but their frequency is much lower than ours. That's why, for us black people, even here in Zambia, if you go to UTH, for example, and check which cancer brings men to the hospital more frequently, nothing beats prostate cancer. Which cancer is killing men more frequently? Nothing beats prostate cancer.
Right. The second question, doctor, has prostate cancer got anything to do with food, the diet?
Well, others have said, and they continue to say, I think you're taking me towards issues to do with prevention and delaying
exactly. That's why I'm going. That's why I was going. Go ahead.
So there's been some write-ups that suggest that you could prevent prostate cancer with your diet. For example, if you have mainly a vegetable-based diet, or you eat a lot of nuts, or a roasted pumpkin seeds.
Imbalala. You mean imbalala?
Yeah.
Ishaba.
Yeah, even groundnuts, cashew nuts, anything that ends with nuts except for donuts.
Now, I hear, doctor, I also hear, I'm not a doctor, but I hear tomatoes, there's a chemical in tomatoes that can help reduce prostate cancer. How true is that? Especially when tomato is cooked. That's what I'm told.
Yes, it is true. That includes broccoli as well.
Munshya, you see, experience talks, Munshya. I've been reading about these things. So tomatoes, cooked tomato, broccoli. What else, doctor?
Cabbage as well. It's been talked about, and so. But the take-home message with these things is that yes, these vegetables help with maintaining the health of your prostate, but they are not a foolproof preventive measure for developing prostate cancer. What has been observed is that Africans who eat a more vegetable-based diet have a lesser frequency of prostate cancer. They do develop prostate cancer, but the frequency is less compared to those who don't. Okay. All right. So that's where the theory comes from, that probably if we encourage the Africans to go back to what they used to eat, you know, vegetables, things like that, or then, and less processed food, and also sex. There's a theory that frequent ejaculation reduces the frequency, not frequent sex, but frequent ejaculation reduces the predilection for prostate cancer. But doctor, again, that has not been proven.
Doctor,
let me be very clear. There's no peer-reviewed journal that has reported that, but there are observations that suggest the same.
Only vegetables, I'm a very good example. And if my family is listening, they know I can't take a meal without vegetables. The other recommendation, I'm not sure. I will decline. I think Munshya can comment on that.
It's not a very strong recommendation, but
I only comment on things that general comments on. So I want to comment as well. How can I be commenting on comment?
Because Munshya, you're 42. Me, I'm just giving you my experience with vegetables. So the other part is your part. So doctor, go ahead. Go ahead and please give us this education, especially for these 42-year-olds.
So now, the foolproof preventive measure. Of course, you can take all these measures, diet that we've discussed, the vegetables, ejaculations. If you're interested in that as well, do it. But the foolproof measure that has been well reported in terms of preventing prostate cancer, it's screening, regular screening.
Right.
Yeah. And that is why you will see that even my social media activities, I spend so much time on encouraging men to do screening than these other things. Right. I talk more about screening because the beauty about screening is that if you catch prostate cancer early, before it starts developing symptoms, you can actually cure it.
So
100% cure it.
Are you saying there's treatment for prostate cancer, doctor?
Yes, there is. If you catch it early, before it starts giving symptoms, you find prostate cancer before it starts giving symptoms, it can be cured. A lot of experts agree on that.
And what's the cure? Is to
go get the prostate, remove it, and throw it in a dustbin.
So you can do without your prostate. I know I've done without.
You can do without the prostate, yes.
So then what happens to those things you were talking about earlier? For those that are joining us right now, you say that there is sperm, and then there are other things that the prostate makes. So if you take out the prostate, it means then that sperm will have no fluids. Is that the thing? It's like you drain Luapula province. Yeah, doctor.
Well, here's the issue. Yes, of course, the volume will be slightly affected. That's not a lie. The volume is slightly affected, but it doesn't mean that you will no longer function as a man. You will still have your erection. It will still be as strong. You will still be able to ejaculate, and you will still be able to have babies.
So prostate,
then why can't we just go and remove all our prostates?
Exactly. It's like appendix. Doctor, it's like appendix. Many years ago, I had my appendix removed. Many years ago in China, it was terrible. They removed it, and they told me, you don't need it. So why don't you recommend that every 15, 20-year-old just remove your prostate cancer? Then you save us from
that. That has been an ongoing argument in the medical field. The argument is that when a man reaches 50, why don't we just go and remove the prostate altogether? But the issue here has to do with the risk-benefit analysis. Surgery comes with its own risks. Okay? So if I take you, who doesn't have any prostate cancer or any threat of prostate cancer, and then I go and I try to do surgery on you, there are some things that can go wrong with surgery. And remember, these are things that are done with human hands. It's not a perfect procedure.
Right.
Yes, the outcomes are good, but sometimes in a few people, there are some risks. Now, is that a risk you want to take in a man who is just functioning nicely? No. But then if there's cancer and it's stage 1, it's a lot more beneficial to go in to remove it despite the risks.
Right.
Yeah.
Now, is it true that we are seeing most of these things in Zambia now more than it used to be? Like, it's much more evident, the prostate issues, the prostate cancer, it's much more evident now than it was a few years ago?
Yes, and the age is also getting younger and younger. I don't understand that. But part of the reason is that we are now talking about it more often. People are becoming more aware, and people are coming forward, which is a good thing. You see, we've done a very good job with cervical cancer in terms of awareness, reaching out, and screening people. Do you know that it's less expensive to screen prostate cancer than it is to screen cervical cancer? But people find it easier to fund cervical cancer than they do prostate cancer. I think we need to continue to bring to the fore the rights of a man. Yes, of course, we do understand that women are more vulnerable, but we have I think we've gone a bit too far in promoting female welfare to the detriment of the man.
Right.
We need to invest more in screening men for prostate cancer. My wish and my desire is one day to have prostate cancer screening free in all public facilities.
Yeah.
And I think it's possible.
Okay.
Because right now, if you come to my facility to do prostate cancer screening, for example, they'll charge you. It's a private facility. They have to pay bills. See?
So where do we go to be screened for prostate?
Well, you could go to any facility, both public and private. Of course, if you go to a private one like ours, expect that they'll charge you a fee. Okay. If you go to the public ones, I don't know whether they're still doing it for free or whether you are still using insurance. I don't know. But you could pretty much go to any facility. They should be able to do it. For us at CarePick Specialist Clinic, we are quite deliberate about prostate cancer. So for men who come here for anything, we actually offer you, should we, can we proceed? Yeah, so we are very deliberate about it. Yeah.
Now, doctor, you talked about processed foods. And one thing which really shocks me when I come back home is the number of people who go to these, what do you call them now, malls. Yes. People have stopped cooking. Everybody's going for pizza. And I'm saying, wow.
Pizza generation, government of pizza. Pizza election.
Don't you think this could be one of the causes of prostate at an early age? Because lots of Zambians love going to the malls and eating pizza. People are not cooking. Besides the vegetables, which I believe in. I believe in that. That's why I'm over 60. Well, I'm 60. I'll be 66 next week. Because it's very important to have a good
week. Happy birthday.
Next week, Mamushana, we'll do it live on Bakwe to TV. It's next week on the 8th. Those who want to give me a present, please just give it to me on the 8th. Now, doctor, diet to me, I believe is very, very important. Exercise and diet, especially with the vegetables. So I see a lot of Zambian men loving their processed foods. And I'm saying, if it's true that the age where people are catching prostate cancer is, Zambian men, wake up, eat better food, go back to your bond way, go back to your, village chicken. That food you're eating is not good for you. That's what I hear. What's your comment, doctor?
Well, I agree, and there's a lot more benefit to eating food that you have cooked yourself. There's a lot more benefit to eating a more vegetable-based diet. And plus exercise, I mean, the benefits cannot be overemphasized. And not just for prostate, but also for all other different ailments. So there's a lot of benefits in
No, doctor, I know
but
that.
Then,
go ahead.
Yeah, but then some things need to be taken into account when you're talking about prostate cancer. Of course, I agree with you that a change in lifestyle and diet has sort of like affected the predilection towards the same. And then you will find that if you look at the risks for prostate cancer, the risks are many, but there are three that are very prominent. And these have to do with your race, the fact that you're black, age as you grow older, and also family history. So if there's prostate cancer on your father's side of the family, not your mother, if there's prostate cancer on your mother's side, it may not affect you that much. But if there's prostate cancer on your father's side of the family, then you are likely to also get prostate cancer. But the challenge we have in Zambia is that we don't know why our grandfathers and uncles died. Most of them, it's brought down to witchcraft.
And malaria.
So we don't know why they died. Yeah.
So, doctor, are you saying prostate cancer can be genetic?
It's very genetic, actually. So, for example, if, say, your father had prostate cancer, then you are likely to have prostate cancer. If your father's dad had prostate cancer, then you are likely to have prostate cancer. If your father's brother had prostate cancer, then your likelihood is increased. But if your uncle on your mother's side or your grandfather on your mother's side had prostate cancer, it's very unlikely that you would, because the gene is carried on the Y chromosome.
Yeah.
So not the X chromosome, it's on the Y chromosome.
Okay. Now this is now science to explain to people in Mumbwa and my relatives in Kalabo and Kaoma and in Chereng. Can you try and explain that again, doctor? It's a genetic issue.
It is a genetic issue, and it runs in families, particularly in black people. Yeah.
Okay. This is something very interesting. Munshya, over to you.
Correct. Yeah.
Number, we have very little time. We need to switch gears. At what point does medicine get interested in premature ejaculation? Why are you interested in it as doctors?
Yes, we are interested in it as a science, as scientists. Here's why. You do realize that the central dogma of life is actually a very strong and healthy erection. without which the human species would not be able to propagate itself. So we need a very strong and because remember, copulation or sexual intercourse, the primary function is propagation of the species. Propagation of course there's the enjoyment and entertainment. Those are secondary to the primary. The primary function is propagation of the species.
Is to keep the species going.
Yes, to keep the generations going. Otherwise we would disappear as human beings.
Yeah.
They are going into bed as we are trying to propagate.
We would disappear as human beings. So from a scientific standpoint, it's very important, and you need that, because otherwise we would not exist as a people and yeah. But then premature ejaculation, by definition, its definition is very subjective. Subjective in the sense that the definition is about did the erection last long enough to the satisfaction of the two people who are involved in the act? So if the erection does not last long enough for the satisfaction or for sexual satisfaction, then it's considered premature ejaculation. So
it's not connected to procreation. So it's not connected to...
No, it's not. It's not. It's not connected to procreation, but you can argue that it is by extension or by extrapolation, because depending on how premature the ejaculation is, you may not have deposited the male seed deep enough to promote pregnancy, as it were.
Okay.
But really, the hallmark of premature ejaculation, its definition is centered around pleasure. It's about sexual pleasure. Yeah. So if one partner in the act, somebody does ejaculate before they get the pleasure, then that is considered premature, because frustration comes in and all those things.
Wow.
Okay. Now again, why should that be of interest to doctors? Okay.
Because here's why. Let me be very precise why it's of interest. Remember that your health is not just the absence of infirmity.
Right.
It is a state of mental, physical, social, financial well-being, including spiritual well-being.
Right.
Now, if there's dissatisfaction in that space, you would not be in a state of mental well-being. So that affects your health as a person.
Right.
As far as doctors are concerned, if you are broke, Munshya, and there's no money in your wallet, you're unhealthy.
Okay.
Because financial well-being is part of the definition of health.
Yeah.
Mental well-being is a part of the definition of health. And you cannot underestimate the value of sex to mental well-being. You'd be very naive to underestimate that.
Well,
that's why it's important to us.
No. Doctor, muingira muri bopente wande. If bapente, you have to wait.
Vapente, please do not listen to the doctor, Vapente. Listen to the doctor. Listen to the doctor, Munshya. Your health is not only just your physical health. I think that's what I've learned. It's more than that. So, Vapente, what is your theory, Vapente?
No. But if we say that it's connected, the thing is, it will now go against some religious held beliefs. That you can't ukuchita tetu ulechita ukuchita in marriage, for example. And if there is no marriage, then what is the alternative? Because that's the inconsistency in medical benefits, for example, of regular sex, and the contradiction of a Pentecostal faith that says
Well, we cannot argue against the morality of preserving oneself until they get married.
All right.
We can't argue against that ethos, and we should actually encourage it, that people should as much as possible preserve themselves until they get married.
Right.
We're not going to sit here and suggest that people should start now having sex indiscriminately. I don't think that's the position we want to take.
But in other words, what you are saying is philachtica.
Well, it does. What I'm saying is that it does. But then, look, here I'm discussing this in the context of a couple who are probably legitimately having sex. And it does have an affectation there if there is premature ejaculation.
All right. Yeah. Now, from premature ejaculation, we must move on now to ED, erectile dysfunction.
Yes, the two are very closely related.
Right.
Yes. The two are very closely related. It's the same as premature ejaculation. There's also delayed ejaculation. There are men who take forever. They keep pounding and pounding and pounding. And yeah, that's also a disorder. And then erectile dysfunction. This is by definition where somebody is unable to acquire or to get and sustain an erection for intercourse.
Okay.
So you'd find somebody who can get an erection quite all right, but it doesn't last enough for vaginal penetration. So it becomes a problem. So that's also considered erectile dysfunction. And then there are others who can just not get an erection. That's all. They just can't get it. So that's also erectile dysfunction. But these things are considered as, it's the same state or same group of disorders. Erectile dysfunction, early ejaculation, delayed ejaculation, and where somebody does not ejaculate at all.
Now, doctor, do Zambian men always want to discuss these things freely?
No.
Or we still have that cultural thing of saying I can't discuss about it?
No, men do, but they do it in their social circles. Come over at a bar and so that's why you see we are now encouraging men to come forward. There's nothing to be ashamed of.
Very important.
Right. Just come. Now the challenge you have is that most men don't like going to hospitals. I've never understood that phenomenon. By the time a man tells you I'm sick, you should be worried. He's probably about to die. So he'll be carrying an ailment for years, or he'll be carrying a problem and doesn't want to come forward. That's why it's very important to encourage men to come forward. There's nothing to be ashamed of. And there's nothing wrong. It's not a sign of weakness to ask for help. Because men sometimes feel like, if I ask for help, you think I'm weak. No, you're not weak, actually. No, we won't even mwenamo you. Just come. We talk. And we're not even going to tell anyone. We're not even going to tell anyone that you came.
Yeah, I think
yes. We actually we need to encourage them to come and sit and talk. I don't know what the fear is. And the assurance to men is that we are not going to tell anyone.
Not only that, doctor. I think we have got women on this program, viewers this evening. Women, encourage your men to go and see a doctor. If you solve any of these issues, encourage them to go and see a doctor, because don't be shy. The idea that men don't want to go to the hospital until they're about to die, I think we should learn to stop it.
Elas, I can give you another 30 minutes. I've noticed you seem pressed for time. So let me give you another 30 minutes. If you have time, we can chat for another 30 minutes before I go.
Yes, let's look at that. Thank you.
Okay. So what I was saying, doctor, is that let's encourage our women, that try and encourage your men, because we are proud people. We are, encourage your men to go to the hospital. The issue of the prostate cancer for me is serious because I've seen my friends die. I've lost some of my best friends because of prostate cancer. And I
Not
didn't
true,
know
I agree.
until some of them very sudden.
Now,
go ahead, Munshya.
Now, doctor, you are Dr. Aaron Mujajati.
Yes.
No, kwali bako na bambi ba doctor. Kusoweto. Nakumbi nakumbi. Elo kwali bana bambi ba doctor. Have you been to Luapula through Pedigo?
I have.
Have you been to a place known as Mokambo?
Mokambo border, right?
Yes.
Yeah, I have.
Okay. So, Pamokambo, napopene peso, because we were Pulans, when we were moving, we moved into Mokambo and Mofulera. So that's our place. Now there are businesses there, doctors, and they sell products to our people. There is a question right now on the timeline. Mm-hmm. Is Congo dust an answer to ED?
That's a very good question, and let me do this. For me to be able to answer that question, we should be able, let me just briefly, very briefly, go through the causes or risk factors for erectile dysfunction.
Okay.
What we need to appreciate is that for an erection to occur, you need blood flow that is not interrupted. So it's basically an issue about blood flow. So for an erection to occur, so you need blood to flow into a very spongy tissue in the manhood, 2 tubes that are very spongy, and blood needs to go in there, fill those tubes with blood. All right, and the muscles need to relax. So the muscles are relaxed, and then you get blood flowing into 2 very big spongy that stretch and widen. Once blood goes in those structures, it is locked in. Once it's locked in, it gets locked in for a while. Once it locks in, that's when you have that erection lasting. Now, anything that disturbs that mechanism will result either in a weak erection or result in somebody not getting an erection at all. Okay. Now, there are different things that can affect that. For example, if you have a lot of cholesterol in your bloodstream and it has narrowed the blood vessels, the amount of blood that can go in there in time is less. So if there's less blood going into those tissues, you might get an erection, but it will be weak.
Right.
And even if you got it, it may not last. Why? Because there's not enough blood going because you have cholesterol. Now, does Congo dust reduce cholesterol in the blood? It doesn't. You can drink as much Congo dust as you want. That cholesterol is not going anywhere. I have to give you a specific drug that must remove that cholesterol to improve that erection.
Doctor, can you explain what is cholesterol?
So cholesterol is like fat. For example, you've seen the calcium that lines the hot water pipe?
Yeah.
You see that calcium that clogs the hot water pipe? That's how cholesterol also clogs the blood vessels. It's like fat. It's like, it's the easiest way to explain cholesterol to a lay person is fat, but that clogs the blood vessels, blocks.
So basically, some food can have a serious effect on your cholesterol level.
Yes, it can. And then cholesterol, you need to be careful with it. There's also good cholesterol and bad cholesterol, but here I'm talking about the bad cholesterol.
Yeah,
so cholesterol, high cholesterol has been known to cause erectile dysfunction. Now, I don't know how. Now, there are some things that can cause a bad erection. For example, you are diabetic, okay? And then your nerves have been affected. So your nerves are not functioning properly. That can cause the sensation to work. So your manhood is not receiving signals because the nerves are affected. Therefore, because the signals, remember that sex is in the head. It's not physical. It's a mental issue, okay? It's not a physical thing. That's why it's very possible to get an erection just by your thoughts. There's no one in front of you, just your thoughts, okay? So
Man, doctor, what you're saying is nimumano. Eh?
Yes, yes. So it's a mental thing. So you find that someone who has diabetes, which is not controlled. I'm not talking about diabetes anyhow. You are diabetic and you are not controlling your sugar properly. The nerves get affected. Do you know that, people who have diabetes and they're not controlling their sugar properly, they end up with pins and needles, and their legs, their feet feel very hot, like they have, That same thing can happen to the manhood. Now, when that happens to the manhood, the sensation dies down, and the signals from the brain are not received properly. No matter how much Congo dust you drink, if that sugar is not controlled, it will not improve. So the point I'm trying to make here is that erectile dysfunction treatment is based on what cause has been identified.
Right.
Okay. So there are some people, for example, they are hypertensive. Right? Certain medication that we give for hypertension, if taken for a very long time, certain drugs can actually lead to erectile dysfunction.
Right.
So for such patients, instead of stopping them getting the drugs for hypertension, you just change the drugs, switch the drugs around, and the problem is resolved. It doesn't mean that they have to go and start drinking Congo dust.
Now, doctor, why do we then see, every time I get to Lusaka, you see these adverts of these herbalists with Congo dust everywhere?
The reason is simple.
Because to me, it looks like it's dangerous. I'm not saying let's run away from our traditional medicines, because most of medicines are from plants. But there are all these adverts, Congo dust everywhere.
I agree. Okay, to be fair, traditional medicines work. You also have traditional aphrodisiacs. They also work. Has Munshya disappeared?
No, don't worry, I'm here. As long as I'm here, don't worry. Let's go ahead. Traditional medicines.
All right.
Traditional medicines work. Doctor, you might correct me. Most of these drugs, whether penicillin, whether whatever, most of them were derived from plants. Am I right?
No, you're right. Yeah. So traditional medicines do work, but the challenge you have is that because most of our drugs we don't measure, we don't have a scientific basis for how we use them. So what ends up happening is that, and also the other challenge is that most people who give out these traditional medicines, no one passed on the knowledge to them properly. Because you will notice that our forefathers, the knowledge was passed on by word of mouth. And the passing on of that knowledge, they also told you, if you do it this way, you're drinking too much. Now, nowadays, anybody can wake up tomorrow morning and put a few roots together and start claiming that they're traditional healers. That is why I have always advocated, even when I was in the Zambia Medical Association, I did advocate to pass a piece of legislation that allows us to formalize our traditional way of doing things. Because our traditional medicines are not completely useless.
No.
We just need to find a way of making it safe and also we need to increase the capacity to pass on the knowledge in a manner that is repetitive. You see, there's value in documenting things.
Right.
If I received instructions from my grandfather, I'll pass on the instruction by word of mouth to Munshya a bit differently. And he'll pass it on the next guy a bit differently. Depending on how he... That's the problem. But if it's documented, you will say, here's a book written by... You see. So if it's documented, I'll tell you, this is what my grandfather wrote 400 years ago, and this is how we've been doing it. Look what he wrote here. Okay. And even when you are improving on the formula, you are also documenting. But we don't have that culture of documentation as Africans. And we just pass on. So as a result, we've lost the good things along the way. And I'm one of those who has no shame to advocate that, we need to go back and pick up some of the good. So some of these aphrodisiacs that are African, they work. The challenge we have, however, is that the dosages are a bit weird. So as a result, some men come with kidney failure. Some they lose the erection for good. And I can explain how that happens. Some of these drugs people drink, Congo dust, name it, what. Remember, I had this, Mwana Peruke, Pwanya something, I can't say it. Remember what I explained about the mechanism of an erection? So blood goes in and it gets locked inside. Right. Now, some of these things, they keep blood inside a lot longer than is necessary. So someone has an erection for hours on end. It even begins to get painful. Now, a painful erection is called priapism in medical language, and it's an emergency. If you don't move quickly, that's the last time that man will ever have an erection in his life. Because the reason what happens is that when you lock the blood inside that penis for a long time, those tissues begin to die because they're now lacking in oxygen. It's like someone has,
suffocated you.
Your neck. It's like you're now strangulating the penis. Okay?
Yeah. Sure.
So you'll find that for people who have experienced this, if you ask them, it was the last erection they ever had. Because the tissues have died, you can't resurrect them. So dosaging is very important. That's why we need to investigate some of these things even if they work. So right. That's my problem with some of these Congo dust things, Pwanya something and whatever. Is that the risk of losing an erection after getting a very powerful one is very high.
Yeah. For me, doctor, that worries me so much because our pharmacists and our doctors should be able to help the government regulate these things, because it's the efficacy in this case and the measurements to me which worries me so much. I know that our medicines, our aloe vera works, all these plants which we have they work. I mean, for our viewers, Africa has got so many plants. Munshya, let me tell you, there's one of them called periwinkle. Doctor, you know. Why
are you picking on me?
Because you are young. So I want to tell you, young man. Periwinkle, what they call the Madagascar weed, is the source for vincristine. Am I right, doctor?
No, it's true. No, it's true. And malaria drugs come from a lot of weeds that we have around. Yep. You know, traditional practice or traditional healers, there are some who are credible, okay?
Right.
There are some who are very credible, and I've interacted with some of them. One of the most prominent traditional healers that I've dealt with and interacted with quite closely is Dr. Vongo himself.
Dr. Vongo, is he still alive?
Yeah, he is. I see him around. We've had some very interesting conversations over the years, and I think that we cannot afford to throw away water with the baby. But anyhow, Munshya, you wanted us to talk about these men's health issues. Let's not go into traditional medicine too deep.
No.
But the point is, traditional medicine is not completely bad.
Okay.
However, if it is not used properly, there are some obvious risks, like kidney failure, liver failure. We see those. And if it has to do with the manhood, you can actually lose an erection forever.
Right.
You will get one very powerful erection, which will last the hours that you want. By the time it is finished, it will never come back.
It's not worth it.
It's true until you go and wipe by.
Yes, of course. Yes, of course.
Okay.
So there are proven methods of the key issue with erectile dysfunction is your problem. Just remember this. If you forget everything else I'm going to say as a man, if you're listening, if you have an issue with erectile dysfunction, remember this, that your problem is not the same as the next guy.
All right.
Because usually what men do is that someone will tell you, me, I drank this, it helped me. But you don't know what his issues are. Your cause is probably different. Yeah.
Right. Now, one of the biggest consumers of traditional medicines, as far as premature ejaculation or even erectile dysfunction is concerned are actually women that are getting them for other men. I read somewhere in a Zambian newspaper or something like that. Is there any credibility to that? That it's actually women that are purchasing all these products for their men.
For the men.
Most merchants who sell these things, yeah, it's true. You find that the peddlers are usually women. I mean, I've been approached by several women who have these things for sale. Yeah, and also you find that you have women who actually buy them for their men and things like that, and secretly put in their porridge or their tea or something. But then you see, be very careful what you're giving to your man.
Right.
Because you don't know what his issue is. You don't know. And it goes back to the point I made earlier. Provided you don't know the cause, do not intervene. You will actually make the problem worse. And, and also the other thing I encourage people who are actually a couple, if there's an erectile dysfunction problem in the couple, it's not the problem of the man, it's a problem of the couple. So I always like to encourage couples to come together, especially, for example, if there's an issue of, say, premature ejaculation. Premature ejaculation is not a permanent state, and most people experience it anyway at one point or another. Okay,
Dr. Ashani, you say that again, because I have a lot of men here and they are angry. Okay, say it again.
No, let me say it. Let's not be shy here. Premature ejaculation is a very common problem. And most men experience it at one point or another. In fact, all men, let me put it this way, all men experience premature ejaculation at one point or another in their lives. It only becomes a problem when the experience repeats itself, like it becomes mainstay. Like that's just your default. You just have premature ejaculation regardless. But from time to time, even a man who doesn't experience premature ejaculation will experience premature ejaculation at one point or another. Okay? So really...
Doctor, you say it is in the brain.
Yes, of course. Because you see, sometimes one of the causes for premature ejaculation is pressure at home. I mean, you go home, she's upset with you all the time. She's not giving you peace. I mean, how are you going to manage these things? It becomes a problem. So you go and start drinking Congo dust when the thing that needs to be fixed at home is to call a pastor to come and put you together. Yeah.
Wow.
So some of the solutions to premature ejaculation require the participation of the partner. So that's why sometimes when you are dealing with an issue of premature ejaculation, yes, there are some drugs that we give. Okay, but again, a better solution is to train the mind. And sometimes in training the mind, you need the participation of your partner. You can't do it yourself alone. No, not only that. There's what we call coitus interrupters. Okay, coitus interrupters is where if a man has the problem of premature ejaculation, you start enjoying yourselves, and at the time when the man feels that he's about to, he has to withdraw and stop. That needs the cooperation of your partner. Your partner needs to know that this is what we are doing. You can't just be stopping power kachabe secret. She will be surprised. What are you doing? Hey, what are you doing? But then you see, you need the cooperation of your partner. Now, the reason that is important is that your brain needs to be able to know that, okay, here I'm about to, now I need to stop. So now what that withdrawal does is that it begins to train your brain. At what point do I stop? Eventually, you will not need to withdraw to stop. You will know that, okay, now I need to stop. You distract yourself. So that's how you begin to. There's also other methods where it's also similar to coitus interrupters. You know that here I'm about to, then you stop, then your partner, not you, your partner, squeezes your manhood until Well, he squeezes it in a healthy way, not squeezing as if they're about to kill you. Squeezes the manhood in such a way that the erection dies down, and then you start again. But like I said, some of these solutions require the participation of your partner. You can't just come alone to us and we start telling you these things. And then what if you go and communicate it differently at home? And then you don't explain things properly. And then she has misunderstood you. And then she does things in such a way that you even you harm yourself because you didn't communicate properly. So some things, like I said, for men, don't feel shy. And if there's a steady partner, a wife preferably, come with her. We discuss.
Okay.
Because
doctors offering
your mind.
Doctors offering such services, or are there other professionals you would recommend? You see, doctor.
Yeah. So for example, the problems of premature ejaculation, erectile dysfunction, I dealt with by a urologist.
Mm-hmm.
We do have urologists in our clinic. I'm a physician. I'm an internal physician. I'm an internal medicine expert. So as an internal medicine expert, I can literally explain any disease because that's what we do as physicians. It's our job to solve problems. But in terms of the actual treatment of these issues, we have urologists, and I am not a urologist, and I'm not going to sit here and pretend that I'm a urologist. I am not. But because I'm a physician, I can explain any medical condition you throw at me.
Okay.
But in terms of actual day-to-day management of the problem, I will refer you to a urologist.
Okay.
Who will deal with erectile dysfunction, who will deal with your early ejaculation problems, who will also manage prostate cancer or prosthetic enlargement. Those are the guys who deal with those things. But as a physician, I can explain.
Thank you. I think
how much does it cost? Before we go, Munshya, how much does it cost to get a test, a prostate cancer test?
If it's just prostate cancer screening, I don't know about other places, but for us, we've really subsidized our cost to just make sure that people come. So it will cost somebody about 300 kwacha, but that comes with the test plus consultation with a specialist. Yeah.
Fantastic. So men out there in Zambia, do not give any excuses, especially if you are 24 and 42 like Munshya. Go.
But you see, I would prefer that.
This is not fair.
I would prefer that prostate cancer screening was free. I wish there was a way it was free.
Right.
But in the private sector, it's not, and for good reasons. These are private entities; they have to pay bills. So
right. Yeah. And it's what is to run a business. Yeah.
You have also mentioned one thing, doctor. Your diet, your exercise, very important.
Correct. I think those, you see, I think health is a combination of factors. Like I said, health is not just an absence of disease. Just because you don't have a disease on your body, it doesn't mean you are healthy. As far as we are concerned as doctors, if you are spiritually troubled, you are not healthy.
Yeah.
If you are economically troubled, you are not healthy.
Right.
If you are socially troubled, you are not healthy. So it's not just so it's a state of well-being. So to achieve a state of well-being, several things are coming: exercise, diet, good relations with people, good relations, job satisfaction is part of health.
Yeah.
Right.
Yeah.
So doctor ngaliaima ifwire lyakosa.
Correct.
What kosa? Enkani.
Munshya. You are naughty. You are very, very naughty.
Okay. We've got to go. Dr. Mujajati, thank you very much for giving us this time. We really appreciate. And thank you. We can call upon you again. Keep on doing what you are doing. I know that as a social media influencer, you and me and General face similar challenges in how do we communicate our message across? How many people are liking what we are saying? For you, you say good morning, and I see 1,000 pages. I'm like, I want to be like Dr. Mujajati. Good morning. Oh, drink water. Drink water. 500 comments. You know, me and General, we try to come up with very complicated sentences. 2 likes. So you are doing a very good job, Doctor. Unfortunately, we don't have any consultation fee to pay you. But we thank you very much for having spoken to us.
We can't afford you, Doctor. We can't afford you. We thank you so much. Really thank you. And for me, really, the issue of exercise, food, and all these things, our men have to be serious and think about that. And please don't be a lawyer. Continue with your MBA. I think better. That's where the money is going to be.
No. Let him be a lawyer. You're welcome, Dr. Mujajati, and you make a very good lawyer, doctor, businessman. Please. And there are so many universities in Zambia. They'll let you do evening classes, night classes, and so flexible. Why not? Even you, General, you also need to do law.
Well, I did business law, and I just didn't like it. But I'm happy with my business. So well done, Dr. Mujajati, for doing your MBA. There are very few doctors, medical doctors, who end up doing MBA. It's very important so that you understand how business runs and how to make money. Because the idea is to make money and being able to keep your customers. So well done for you. Well done.
No, thank you very much. And Elias, thank you for inviting me. I think I've had a good time. And in terms of what we do for our country, we just have to keep doing it. You know, social media has a lot of negative uses, but some of us have decided to use it for good use. And I admire your job, the work that you're doing. I follow what you do, and the commentary that you provide, and the way you do shine the light in your own field. We need more and more of that. And I think that there's value in sharing knowledge and making sure that people make informed decisions. So thank you for the invitation. And should you invite me again, I will come. I can assure you.
We will definitely. There is we'll definitely invite you, Dr. Mujajati. Yeah.
Thank you.
And that's our friend Frank. One of our regular friend and contributor.
Right. Nice to meet you, Frank. General was nice to meet you as well. I just watched you on this brother's channel, but it was good to chat with you.
General, I told you to watch it. You see?
The advice you'd give this young man, Frank, because he has to start thinking of screening. I will not embarrass you. I will not embarrass him and tell you his age, but I think he has been listening. I hope you can go and screen. Very important.
I'm sure he will.
It was very good. And I like the fact I know Mr. Munshya just looked so embarrassing. He's so embarrassed. He's so funny.
Thank you. Please say sorry to our mother, Dr. Mujajati, and say Nifotu alenga tmuyeret.
No, I got adequate permission. So I was given enough visa, so I have enough permission. So don't worry.
All right, thank you. Good night, everyone. Give us Dr. Mujajati. So our page has been monetized.
Right.
So what that means is that it's been monetized and people can send stars to us. So they buy money from Facebook and then they send us stars. So we always talk about it.
Okay.
Yeah.
That's quite interesting.
Yeah, it's one of the interesting things. But Zambia is not yet monetized, so it can't happen in Zambia.
No, you cannot monetize Facebook in Zambia. Yeah, we are not on that list. So yeah.
Yeah.
Okay.
No, nitumezi bo Dr. Mujajati.
Nisha mulobale hande luitumezi.
Mulabale hande liminandate.
Mulale
Mulabale
zvakanaka.
Tatenda Dr. Tatenda.
Okay, thank you. All right.
Nisha, let me run. Enjoy the rest of the programming, gentlemen.
Thank you so much.
All right. Thank you for having joined us today. We've got to sign off now. Good night, Zambia. Good night, Scotland. Good night, England. And good afternoon, Alberta. God bless you. Thank you.
God bless from England.
All right. Thank you. I hope you join us next time. Thank you very much. Good night.